Okay, hi team. I'm going to get started. I'm recording this so that y'all can have this for future reference, and I will get this sent over to Wally so that he can um, grant you guys access. Okay, so we're talking about periodontal disease and perio protect tray therapy today. So how do we incorporate this? Understand that it is our mission to improve patient health and wellness and quality of life. Most offices look to Perio Protect for help with long-term treatment and the trays because we know we can improve patient home care. What you do in the office, we're going to continue to do, right? It's once they leave our office, how do we keep these patients healthy? So it's important to know that, I think somebody's trying to get in here. Hang on. Oh, it's important to know that patients are trying at home, but these chronic infections that induce gingivitis and perio are hard to treat with a toothbrush, rinse, and floss because they just don't get deep enough. So, what is going to get deep enough to help these patients? Again, this is a slide of bacteria that grew within 48 hours in that patient's pocket. So the scanning electron microscope image was captured from a study of carriers that were sterile before placing into the 5 to 6 millimeter perio pocket, and they were left there for 48 hours. That carrier was completely colonized by biofilm in just 48 hours. So this is the stuff daily that we are after. So we know that periodontal disease is chronic, it's destructive, it's an irreversible inflammatory disease state. So we are trying to get that bacteria that penetrates very deep. Um, there are a lot of things going on in that pocket, and that host response attempts to defend against invading bacteria, and it causes host defenses leading to destruction of the periodontium. It attacks everything, the periodontal ligament, the cementum, the alveolar bone, the tissue. So we are trying to penetrate deep down in there. Um, Staging and grading, I'm hoping that you all are doing this in your office, is really no different than the old days, the early, moderate, whatever. They've just broken it down so that it's easier. And honestly, when you talk to patients, if you're talking in stages, it's just like cancer, right? Stage 1 is early. Stage 2 is a little bit more involved. Stage 3 and 4 are moderate and advanced. So I'm hoping that you all are using the staging and grading system. It's super easy. I think this little diagram and chart has it pretty well broken down for easy explanation. And this should be going in your documentation also. Um, Grading is strictly the progression. Also is super easy. Basically, it's a non-smoker is going to be grade A. No diabetes, no comorbidities. They're going to be grade A because the progression is most likely going to be slow. Grade B, this is when they're smoking cigarettes, they have H1C, they have other issues, and we're seeing radiographic bone loss less than 2 millimeters over 5 years. And grade C is rapid, right? And these are also your smokers, a little bit heavier smokers, 10 cigarettes or more a day, and A1C is greater than 7. This is again very easy to do. Staging and grading, it's the worst, so you have to kick it up to the worst variable. And we know that there's risk factors in perio, and the modifiable risks are smoking, hygiene, diabetes, pregnancy. Oral hygiene plays a significant role in initiation and development of periodontal disease. Biofilm and those periopathogens increase the severity and prevalence of perio disease. The anaerobic bacteria are the ones that are really, really destructive, and they are colonizing deeper in the periodontium, causing the destruction. Non-modifiable risk are age, heredity, and genetic factors. Not a whole lot we can do there, but for this anaerobic bacteria, and you can see them listed up here, these are the ones that are causing the problems. This is what Perio Protect is after. Why? Because these anaerobes are the ones that are causing the inflammation, the bleeding, and the infection. They cause that junctional epithelium at the base of the pocket to be inflamed. When it's inflamed, it bleeds. So when we use these trays, just think about the hydrogen peroxide flowing down into those pockets, oxygenizing, and actually suffocating the bacteria that is being so destructive. At the chair, we're typically scaling, we're irrigating, and we're dropping in site-specific antibiotics. And that's fantastic. And a lot of times we'll send them home with an antimicrobial rinse. But honestly, those home health aids like toothbrush, floss, water pick, interdental aids, they don't get deep. They don't get to the fore and deeper pockets. So this is where PeriProtect trays are extremely important. So remember, it's a two-part thing. And remember, bleeding isn't normal. So since the brush, the floss, the interdental aids, the toothbrush can't get deep, this is when we are going to suggest to the patient Perio Protect trays to help fight those infections deep down and hold the medication where it needs to be held for the 10 to 15 minutes. Remember, it's just 1.7% hydrogen peroxide, and it is an antimicrobial. Down those protein chains and then starts after the cell wall, and it's just going to attack one layer at a time. That's why when we start them on these trays, we say twice a day for 10 to 15 minutes for 3 weeks. Let it go layer by layer. Take away that bacteria load in the mouth, and then they can drop down to once a day. And we are going to literally keep that bacteria load low so that we can decrease pockets and eliminate the bleeding. And remember, it's that peripheral seal along that gingival margin that helps keep that hydrogen peroxide in that pocket, helps keep that oxygenation deep in the pocket, let it do its thing. So it's really important that these trays fit properly, tight, snug when we deliver them. And remember, they're the only tray out there that is recognized by the FDA to be a deep delivery system as a medicament, and it should fit like a glove. Remember, it's first an antimicrobial, second, it's an oxygenating agent, right? Which actually bubbles up, and it after that 15 minutes, it's going to turn into oxygen and water. So nothing bad's going to happen if they wear it too long, but they really need to wear it the 10 to 15 minutes so that the oxygen that is released increases that volume pressure in the trays, and that is what is going to destroy that bacteria. And it's actually going to change the microenvironment of the pocket. It's toxic to the gram-negative anaerobes that are causing all these problems down in that pocket. So this is a great adjunct. Remember, hydrogen peroxide is a wound cleanser. It's a debriding agent. It's going to attack that cell wall and that matrix. It's going to oxygenate in that pocket, right? And remember, big, huge factor here. No allergic reaction Why? Because we make hydrogen peroxide in our body. We make it in our liver. When we breathe, we're exhaling hydrogen peroxide. So there's no allergic reactions. And it's not like an antibiotic where you can build up resistance. We don't get that with the hydrogen peroxide. And it's also safe for pregnant and lactating patients. And remember, we got to focus on bleeding because bleeding is not normal. It is not healthy. And we know that if we can keep them maintained and not bleeding, we are going to have a increased chance of no further periodontal damage going forward. And that's really what we're after, right? Again, it's 10 minutes per kill, 15 minutes for full oxygenating benefits. And I always tell the patient, longer is better because we know how they can cut corners. It's just like brushing, right? So remember, 15 minutes, I always go for 15. That way I know that they're going to at least keep it in there. 10, if you can get them to wear it 15, great. Work it into their daily routine. If you can get them doing it with something else they're already doing during their day, they're going to forget that they're even wearing their trays, whether it's working out, walking their dog, watching their favorite show, watching the news, scrolling Facebook, Instagram, whatever. Hook it into something that they're doing every day. Um, I love this photo because up top, this was a surgical case. They needed surgery, but even after surgery, that middle, whoops, sorry, let me go back. That middle photograph, that's after perio surgery. They're still not 100% beautiful, right? They're not pink. They have inflammation. Look at that interdental papilla, what it looks like. It's puffy, it's red. I probe that, it's going to bleed. I explore around that gingival margin. I know it's going to bleed. That is not healthy. But that lower photo is 6 weeks of wearing periodontal trays. That is a great result. That's what we want from home care. Not, oh, it looks better. We want it to look great, right? Great with no bleeding. That's what we're after. Okay, that's what I have on Perio and trays. Does anybody have any questions? You can either come off mute, you can put it in the chat. I'll bring up my chat in case anybody has any questions. Any questions from anybody? Remember, this is home care for a lifelong disease, right? Periodontal disease doesn't go away. All we're trying to do here is stabilize and maintain, stabilize and maintain. Just like any other medication that you would take for chronic disease, you don't stop taking it, right? You continuously take it until we can maintain them. It doesn't mean you back off. You just keep doing it, right? So that we can keep them as healthy as possible with either not sending to them to the periodontist or not having to redo a scaling, right? We're trying to lengthen those times out, keep them out of the perio chair. Where is the most effective within the tray to place? Oh, on the occlusal surface. So when you are delivering trays to patients, I always give them one tray, you keep one tray. You load the first tray so that they can watch you. It's just a thin gel of ribbon on the occlusal surface. Once they put the tray in their mouth, it's going to be delivered into the pockets through positive pressure from that peripheral seal. It's going to keep it there, okay, for that 10 to 15 minutes. Good question, though, Susan. Any other questions? Whether you're using it for gingivitis, perio, or even someone who does not ever want to go down the road of periodontal disease, it's always going to be, you put it in the same place in the tray, which is the occlusal surface, and you're going to wear it 10 to 15 minutes every day. Okay? Any other questions?
No, ma'am.
Okay, thank you, everybody. Have a good afternoon.
You too.
Bye.
Bye.